My name is Reena Merwaha, and I was diagnosed with stage 3 breast cancer in September 2014. It was very shocking to us because there was no history of breast cancer in my family, not even in my extended family. But I was hopeful, and my doctor gave me prognosis that there's so much more that can be done and I can be cancer free. So they started with chemotherapy. I went through 6 rounds of tough chemotherapy, but I was unfortunate because I was not responding to any chemotherapy. My tumor kept growing while I was on chemotherapy. So they had to stop my chemotherapy, and they started with this salvage treatment, radiation. I went through 25 rounds of radiation that helped me shrink the size of the tumor. And finally, in May 2015, my mastectomy was done, and there were multiple lymph nodes that were removed. But before my chemotherapy, there were CT scans done that revealed some small nodules in my lungs. My doctors were not too positive. They thought it could be benign. It could be cancerous because they were less than 1 centimeter. So there was not a big issue at that time. And after my mastectomy, my surgeon told me to hold on to chemotherapy because I had an open wound. So and my pathology report showed I got clear margins, and I was happy. I was celebrating. I thought I was getting close to remission. But all that happiness vanished when I felt severe pains in my spine within a week of mastectomy. The problems started emerging. I was getting shortness of breath. I was losing weight. And I could not eat. So I went back to my doctor, and the tests revealed that there was tumor that was compressing on my spine. To control this issue, I went through 5 rounds of radiations. And then there was CT scan done, and that revealed that there was pleural effusion in my lung. And finally, my MRI showed that there was 1 centimeter tumor in my liver. That 1 centimeter liver turned into 12 centimeter within a month. And my right lung was completely compromised. The tumor went so aggressively that my doctors had to start chemotherapy right after radiations. But I was told that since I have not responded to any chemotherapy so far, so the next 5 weeks are very critical for me. And sure it was, because I was having new pains in my back. I was admitted to emergency because there were sharp pains, new spots in my spine that I was unable to get up. Now I have just 1 more chemotherapy, and after that they will do tests to determine if this chemotherapy works. My doctor did tell me that if this doesn't work, I might have to go for clinical trials, which may or may not work for me. So it does feel like a death sentence to me. I'm living in fear. I don't know what's happening, and I have to wait for my results. But I'm still hopeful. I have faith that there is some treatment plan that's going to benefit me. I have done my research, and I found out there are better treatment options in US. There's so much more than chemotherapy. There's so much more that can be done. There are more clinical trials. There are more exposure of drugs that are approved in US and they are not approved in Canada. I want to give myself 1 fair chance. I want to try those options there, and I want to see If that treatment works for me, I'm hopeful. I have faith that I can make it through. All I need is your support, your prayers, and your donations. Please help me. Please help me fulfill my dream of seeing my kids grow. I have a very young family. I have 2 beautiful kids and a loving husband. I want to spend time with my family. I want to see my kids grow. All I need is some time so I can spend with them and I can see them grow. I haven't seen them in last 3 weeks. I have sent them away. My heart is pining to see them back. Please give me one more chance and help me fulfill my dream. Thank you.